My name is Marco Talarico. I am a hematologist and I work as a PhD student at Seragnoli Institute of Hematology in Bologna. And I take care of patients with multiple myeloma and other plasma cell dyscrasias. We have made a research regarding a comparison between the two most important functional imaging techniques, which are PET-CT using FDG and whole body diffusion weighted MRI. FDG PET-CT is currently considered the standard imaging technique in multiple myeloma, since it allows detection of osteolytic lesions, which are a diagnostic criterion for symptomatic active multiple myeloma treatment requiring, and it is necessary for response assessment. Since 2016, International Myeloma Working Group guidelines recommend its use for imaging minimal residual disease evaluation. However, in our study, we are comparing this imaging technique to whole body diffusion weighted MRI, which is a novel MRI technique using the so-called diffusion weighted imaging sequences, which are very useful in discriminating active and inactive lesions. So in our study, diffusion weighted MRI was more sensitive than PET-CT in detection of both focal lesions, which is similar to literature data, and paraskeletal disease. We also observed a perfect concordance between the two techniques in the detection of extramedullary disease, which is a negative prognostic factor in multiple myeloma, and for which PET-CT has always been considered the standard technique, but we see a perfect concordance with whole body diffusion weighted MRI. And now we are conducting a second part of the study comparing the two techniques in response assessment, and we are observing a very good concordance between the two techniques. Whole body diffusion weighted MRI response assessment has already been proved prognostic, since the achievement of a response by this technique is related to patient's outcome, but currently there are no prospective study comparing the two imaging techniques. So our study is the first one. Since currently the International Myeloma Working Group recommends PET-CT as the standard imaging technique, this is the first imaging technique to use. And currently, the NWG recommends the use of MRI scans in cases without a positive CTE or PET-CT, so in cases without osteolytic lesions, and in absence of other myeloma-defining events, so when there are no treatment criteria, in order to assess the presence of focal lesions by MRI, which would represent, if at least 2 greater than 5 mm each, a treatment criterion for multiple myeloma. So in these cases, MRI is mandatory. However, we are assessing the use of whole body diffusion weighted MRI, which is proving even more sensitive, and we are currently waiting for novel imaging recommendations, which will likely recommend this imaging technique.